I'm Dr. Jules. I'm a physician here at CUYUGAN Med Office. Here are my residents, Dr. Neil, Dr. Hannah, and Dr. Madeleine. How can we be of help?
Hi Doc. I've been experiencing heartburn and difficulty in swallowing for the past few weeks, and I noticed it first when my friends and I were in a Korean barbecue place, and then from then on, I would constantly experience heartburn after I eat and very frequently in a day.
How long have you been experiencing these symptoms?
For almost 2 to 3 weeks na po, Doc.
Okay, so we will request a number of tests. These include an X-ray, an esophageal manometry, and we will be monitoring your pH levels as well, and also an upper endoscopy. So that we could be more certain of your diagnosis. You can book an appointment online and then go back to the clinic that is stated on the link that we will send you through email. Okay?
Thank you po, Doc.
Okay, thank you and have a nice day. Okay, so you've heard that we will be conducting a series of tests to the patient. Can you name and state the importance of some tests, Doc Neil?
Yes, doc. So we have a test called upper endoscopy. So this is an examination of the lining of the stomach, esophagus, and the first part of the small intestine with a flexible endoscope. This permits treatment of an esophageal stricture by dilation, doc.
Okay, so thank you, Doc Neil. So, Doc Hannah, what is the importance of an esophageal manometry?
The use esophageal manometry is important because it is the placement of a pressure-sensitive catheter into the esophagus, which permits evaluation of the strength and coordination of muscle contractions, strength and relaxation function of the lower esophageal sphincter. That's all.
Thank you. So, what about pH monitoring and barium studies, Doc Madeleine?
Hey, Doc. We also have a test called barium studies. So the X-ray will be evaluating the structures and motor functions of the esophagus. And the first test used in patients with dysphagia. So next is pH monitoring. It is an acid sensitive catheter is placed in the esophagus and is attached to a small monitoring device that records changes in esophageal pH up to 24 hours, Doc.
Hi, JM. How are you feeling today?
Hello, Doc. I'm slightly okay, but not really.
Sorry to hear that. So, are you experiencing any new or worsening symptoms?
I feel like I've been experiencing the heartburn more frequently. And yes.
We have received your test results, and based on the results, you have gastroesophageal reflux disease, or more commonly known as GERD. But before we proceed, we have to make an assessment of how healthy your lifestyle is, um, which may have led to the condition. So, naninigarilyo ka ba?
Yes po, Doc.
Madalas kumain ng malalaking meals,
Opo din.
and after nito, hihiga ka agad.
Usually po.
Okay, so in a day, how many cups of coffee do you usually consume?
I'm really fond of drinking coffee, so maybe 4 to 6 cups po in a day.
So how about alcohol?
Um, Usually po with friends.
Kapag ba sumasakit yung ulo mo, do you take ibuprofen or aspirin?
Yes po, Doc. Ibuprofen po.
Okay, so in addition to your test results, should the assessment we just had confirms that you have GERD.
Doc, what's GERD po?
GERD is a chronic digestive disease where the liquid content of the stomach refluxes into the esophagus. This occurs when stomach acid frequently flows back into the tube connecting your mouth and stomach or the esophagus. This backwash can irritate the lining of your esophagus, which explains the parang masakit, di ba?
Opo.
So Dr. Hannah will explain how you may have acquired the said disease.
So, GERD results when the sphincter is weakened and not working properly. There are some risk factors, though, including obesity, diet, and pregnancy, which can put you at a higher chance of developing GERD. It's a chronic disease, which means it develops and worsens over an extended period of time. If left untreated, it can damage your esophagus and even lead to esophageal cancer.
Thank you, Doc Hannah. So, Doc Mads, what changes would we usually observe in the anatomy and physiology of patients diagnosed with GERD?
Okay. Thank you, Dr. Jules. So with GERD, you can experience acid reflux from time to time. GERD is mild acid reflux that occurs at least twice a week, or moderate to severe acid reflux that occurs at least once a week. So most people can manage the discomfort of acid reflux, the GERD, with lifestyle changes and over-the-counter medications. But some people with GERD may need stronger medications or surgery to ease the symptoms. Then usually, if you are diagnosed with this, we can clearly observe the esophageal stricture. So it is the narrowing of the esophagus. So due to the damage to the lower esophagus from stomach acid, it can cause the scar tissue to form. So the scar tissue narrows the food pathway, leading to problems with swallowing. So you may feel a discomfort when you are eating. Next is esophageal ulcer, where we can observe an open sore in the esophagus. So the stomach acid can wear away tissue in the esophagus, causing an open sore to form. An esophageal ulcer can bleed. So this may cause pain and make swallowing very difficult. So next one, you can also observe Barrett's esophagus. So this is a precancerous changes to the esophagus. So the damage from the acid can cause changes in the tissue lining the lower esophagus. So these changes are associated with an increased risk of esophageal cancer.
Okay, thank you, Doc. How about you, Doc Neil? How would you suggest we proceed with our course of treatment for JM?
Yes, doc. So with GERD, I would recommend some medication and slight changes in lifestyle. So one main pharmaceutical treatment option is proton pump inhibitors, or the PPI. So these decrease the amount of acid produced by the stomach. I would also prescribe other options such as antacid. So the antacids counteract the acid in the stomach with alkaline chemicals. It acts by neutralizing stomach acids, thereby providing quick relief. However, there are side effects which could include diarrhea and constipation. I would also prescribe H2 blockers. So the H2 receptor blockers do not act as quickly as the antacids, but they provide longer relief and may decrease acid production from the stomach up to 12 hours. Another medication is prokinetics. Prokinetics, so these help the stomach empty faster. So mas mabilis na stomach emptying. However, side effects may include diarrhea, nausea, and anxiety. And lastly, I would prescribe the erythromycin, which is a type of antibiotic that also helps emptying the stomach, doc.
Okay, thank you. So, JM, alongside the medication you would take, it would be better if you consider changing your diet. For example, avoid the intake of high-fat or greasy foods, tomatoes, citrus fruits, mga chocolates, di ba? Garlic, onion, and spicy foods, caffeine, and alcohol as well. And medyo taasan mo yung proportion sa diet mo ng vegetables, ginger, oatmeal, non-citrus fruits, yung mga lean meat, tsaka egg whites. But we also have surgical options, lalo na if masyado na naging severe. Right, Doc Hannah?
Yes, Doc, that's true. If lifestyle changes do not significantly improve the symptoms of GERD, or medications do not have the desired effects, a gastroenterologist may recommend surgery. Surgical treatments may include fundoplication. Fundoplication, which is known as the most common procedure, the surgeon sews the fundus, or the upper part of the stomach, around the esophagus, which puts more pressure to the lower end of the esophagus and is generally successful at reducing reflux. And another one is the endoscopic procedures. This is a range of procedures including endoscopic skewing, which uses stitches to tighten the sphincter muscle, and radiofrequency, which uses heat to produce small burns that help tighten the sphincter muscle. The third surgical treatment is the link surgery, which surgeons wraps a ring of tiny beads around lower esophageal sphincter, which is strong enough to keep the opening closed to refluxing acid, but food can pass through it. That's all, Doc.
So, Doc, what can you suggest so that I can prevent this from happening again in the future? Or maybe you have any advice or maybe alternative medicine?
Okay, JM, medicine can only go so far. You also have to do your part as well. So, for the prevention, other lifestyles and behavior changes can help relieve GERD. So, this includes eating moderate amounts of food and avoid overeating. So, stop eating 2 to 3 hours before sleeping, and also don't immediately lie down after eating. Quit or avoid smoking because this may decrease your sphincter's ability to function properly. Also, losing weight can also prevent symptoms. So there won't be too much pressure in your abdomen, and also to avoid acid reflux. Do not wear clothing that is tight around your abdomen, and also sleep at a slight angle with the head slightly elevated. So if you experience this while you are trying to sleep, try elevating your position. You can put something hard under your bed or pillow like a book, and don't just add a pillow because it won't be effective at all. So for the alternative medicine, the options can be herbal remedies. So like licorice, chamomile, ginger root, peppermint oil. These are sometimes used to ease the GERD. You can you can drink tea for once every day. You can also put peppermint oil to ease your stomach problems. And next is relaxation therapies. So with this, you can do like acupuncture or when you feel bloated. So techniques to calm stress and anxiety may reduce signs and symptoms of GERD. That's all.
Thank you so much, doctors.
Thank you. Thank you very
Thank
much.
you
You're
po.
welcome.